The first case of COVID-19 identified in Wuhan, China and presented as such by the World Health Organization was actually days later than the previously believed and at an animal market, a top scientist said in the journal Science on Thursday. Rather than the original patient being a man who had never been to the Wuhan market where wild and domestic animals were sold, the first known case of COVID-19 turns out to be a woman who had worked in the market, virologist Michael Worobey wrote. For Worobey, the key piece of information and his analysis of other early cases of COVID-19 in the city clearly tips the scale towards the virus being originated in an animal. With no definitive evidence, debate has raged among experts since the start of the pandemic almost 2 years ago over the origin of the virus. Worobey was one of the 15 or so experts who, in mid-May, published a column in Science demanding serious consideration of the thesis that the virus had leaked from a laboratory in Wuhan. In this latest article, he argued that his research into the origin of the outbreak provides strong evidence of a live animal market origin of the pandemic. One criticism of the market theory was that because health authorities raised the alarm about case of suspicious disease linked to the market as early as December 30, 2019, it would have been introduced a bias that led to the identification of more cases there than anywhere else, since attention had already been drawn to it. To counter this argument, Worobey analyzed cases reported by 2 hospitals before the alert was raised. Those cases were also largely linked to the market, and those which were not were nevertheless geographically concentrated around it.
Subscribe to Oneindia channel and never miss an update.